Welcome to the Learnskin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services. If you have a medical concern, please consult with your physician.
Hey Raja, how are you today?
Hey Hadar, podcast time again. We got a cool topic today.
Oh yeah, big time. I've been waiting to talk about this for a while because you know me, I like my gut, I like my food, but I don't like when bacteria gets involved there. And recently there's more and more growing evidence about SIBO, so I was wondering if we could talk about it today.
Yeah, small intestinal bowel overgrowth. Yes, and we have a clinical expert, Dr. Lela Altman. She's a naturopathic doctor and an acupuncturist. She teaches up at Bastyr University, and she started and also practices in the Digestive Wellness Clinic. Welcome, Lela. We appreciate you joining us on the podcast.
Welcome.
Thank you. I'm so happy to be here.
Yeah, just what we need, a gut expert. Thank you.
Exactly.
Thank you.
So, I thought we could just jump right into SIBO, but before we jump into some of the specifics on, diagnosis and subtypes, just wanted to lay the groundwork that, Hadar, we see this in dermatology. We're starting to see this connection, especially to the skin, because SIBO has now been associated with rosacea, also with systemic sclerosis. So it's starting to gain more traction and conversation.
Right.
Lela, do you think this is the same? I mean, is there more and more conversation in the naturopathic communities about SIBO, or has that been going on for a while now?
I would say SIBO has been talked about in the naturopathic communities for about the last 8 to 10 years. So I think it's been going on a little bit longer there. Now, I'd say most naturopathic practitioners are aware of it, have some knowledge of it and generally how to treat it. But I think the number of people being diagnosed with it is increasing a lot, and it's just becoming more aware in general in the community. And so, there's conferences specifically all just about SIBO.
Yeah, it's definitely worthy of conversation. And so it sounds like it wasn't that new, but we're definitely talking about it, I think, in all other fields of medicine now, be it allopathic or osteopathic or Ayurvedic. I think the concept of SIBO has now started to rise more and more to the forefront. Well, that brings us to our first question. What is SIBO, if you don't mind defining it for us? And I've been hearing more and more about subtypes of SIBO. So can you break that down for us?
Sure. So SIBO it's an overgrowth of bacteria in the small intestine, which shouldn't really have a lot of bacteria in it. You have the stomach with the stomach acid, which kills most of the bacteria from our food. And you get increasing amounts of bacteria as you go through the small intestine towards the large intestine. But you shouldn't have a lot of bacteria in the small intestine. So SIBO essentially is when there's an overgrowth of bacteria that occurs in the small intestine. And so it can come from, like I said, lack of stomach acid, not killing bacteria in our food, or backup of bacteria from the colon into the small intestine. There are lots of different underlying causes of SIBO that we think of. The list of conditions associated with SIBO is very, very long, but there are 3 main types of SIBO. So when you're thinking about subtypes, the subtypes that we commonly talk most about are methane and hydrogen, although there is now a third subtype, hydrogen sulfide, and this is primarily based on the gases that the microbes produce in the gut. So hydrogen is produced by bacteria. Methane is produced by a prokaryote called Methanobrevibacter smithii, and hydrogen sulfide is produced by bacteria. And so the way that we think about these and treat these 3 different types of SIBO may be different. Hydrogen sulfide SIBO is really a newer concept, and a test was just developed for that. It's currently getting FDA approved right now. So we don't have as much data for hydrogen sulfide in terms of treatment, but we do for hydrogen and methane type SIBO.
So that raises the question naturally, because we're talking about the 3 subtypes, which, by the way, it's pretty cool that now they're expanding our knowledge around SIBO with this 3rd subtype. How do you diagnose it? And what are some challenges with diagnosis? Because we've seen that the diagnosis really does depend on being able to measure something. So what are your approaches to diagnosing it, Lela?
So there are really two ways to diagnose SIBO. The most common way is a SIBO breath test. And this looks for hydrogen and methane, and now, hopefully soon, hydrogen sulfide. And we use different substrates with these tests. So most commonly in the United States, we're using lactulose or glucose. And there are different pros and cons to using these different substrates. Lactulose is a synthetic non-absorbed sugar, and so our bodies don't absorb it, so it's just left for bacteria to ferment. That means that sugar can get farther down into the intestine, and so we can see SIBO if it's present in the distal small intestine. Glucose is absorbed more proximally in the small intestine, so it's really more specific for small intestinal bacterial overgrowth. But if it's not in the proximal small intestine, we may miss it. The other test that is done for SIBO is called jejunal aspirate. That's usually done on endoscopy. And I don't see this done very frequently. Usually people are getting a SIBO breath test. Sometimes I'll request that a jejunal aspirate is done if I know that somebody's also getting an endoscopy. But given the invasiveness of that, people don't typically get jejunal aspirate just for the purpose of diagnosis.
And so are these breath tests available at the bedside?
They are. So breath tests are available in kits that actually you could take home and do from home. And then the test tubes that collect your breath samples can be brought back into a location or mailed back into a location to be tested. So many people do these just from home. You can go into a facility to have them done as well. When I test children, I often send them to our children's hospital where they have a mask that can be used to collect breath. But for most adults, that's just done from home.
Now, what about symptomology? I'm wondering if this is an abnormal situation. Do you find that patients usually have any symptoms, some discomfort or anything like that?
Yeah, the biggest symptom I would say of SIBO is bloating. That's one of the big sort of triggers for me to think that maybe this is SIBO. Other, symptoms may include diarrhea, constipation, flatulence, often abdominal pain. Sometimes if it's severe, people will lose weight due to malabsorption. And maybe they have anemia from malnutrition. Often I'll also see people with reflux or GERD, which I think is from the bloating pushing up on the stomach. The symptoms are really similar to IBS. And so often these people are just diagnosed with IBS and then given medications for management of symptoms. But up to 60 to 80% of people with IBS, if you test them, have SIBO.
Lela, this is very interesting to me because this raises the whole idea of how foods might modulate SIBO. Just because I think about certain foods can lead to more bloating than others, and there's a few that can increase your chance for flatulence and whatnot. So I got to ask, are there foods that increase your risk for SIBO-like symptoms? And do you talk to your patients about different sorts of diets and food approaches?
Yeah, diet is definitely a big part of what I'm doing with patients with SIBO. So I don't necessarily think that there are foods that cause people to get SIBO. But once you have SIBO, there are definitely foods that aggravate it. So I think many of us are familiar with the low FODMAP diet. So this diet limits fermentable fibers. So fermentable food components feed bacteria. It's things that you eat that your body doesn't break down, so bacteria do. And so limiting those things can be really helpful for people with SIBO. So I'm often using a low FODMAP diet. There are a lot of other diets out there that people talk about for SIBO, but I think the low FODMAP diet is the best studied. In my opinion, it's been the most effective.
And for our listeners, what kind of foods are those?
So the low FODMAP diet there's no rhyme or reason to it. For example, broccoli florets are low FODMAP, but broccoli stalks are high FODMAP. And broccolini is the opposite.
Absolutely genius.
And a ripe banana is high FODMAP.
That'll make it so easy to put together a regimen, doesn't it?
Yeah. So it's super complicated. So it's not like a category of foods, really at all.
Oh, that's really interesting.
There are some fruits, some vegetables. The thing that tends to be not high FODMAP ever is, meat. But I'm recommending that people get an app. I often use the Monash University app to help them sort of figure out what foods they can and can't eat. And I'm typically having them work with a dietitian as well.
Yeah, I think always using a professional is a good advice.
Yeah, and this is pretty interesting, Lela. So just to talk a little bit more about food recommendations, do you ever give them specific foods then that people should be eating, or do you have any handouts for specific recipes that people should try, or how do people go about incorporating a low FODMAP diet, just practically speaking?
So like I said, I really like to use the app because there are a lot of handouts that come out. Stanford has a great handout as well, but the app updates automatically
Oh,
when
very
your
cool.
foods are studied.
I see.
And so I'm usually having people eat so there's green, which is low FODMAP, yellow, which is moderate, and red, which is high FODMAP. So I'm usually advising people to eat as many of the green foods as they want, to, slightly limit the yellow foods and to try to avoid the red foods or just have not very many servings of them. And so that list would then be available for them on their phone. I would say that the things that I tend to see people react the most to are garlic and onions and apples. Those tend to be the biggest triggers that I've seen in people with SIBO.
And is there any specific type of apple, green apples versus red apples? Does it make a difference?
No, there are only a few apples that have been looked at, but they're all high FODMAP. As are pears, all the different types of pears that they've looked at. There are sometimes it's a little bit different. So mushrooms typically are high FODMAP, but oyster mushrooms are not. So sometimes you can find a different type of something that's not high FODMAP.
Yeah, I guess we just said that it can be complicated, but maybe it's an advantage because you don't have to lose the food types that you really, really like. You can just eat some certain types and certain parts of the food. I was wondering if this diet is useful for all types of SIBO.
That's such a good question. So I think this diet is the most useful for hydrogen type SIBO. I think methane type SIBO, we used to put people on low FODMAP diets, and in my opinion, it doesn't seem that effective. And my colleagues have said similar things. So now actually with methane type SIBO, what we're starting to do more is think about actually providing more prebiotics and fibers and probiotics to allow the bacteria to sort of crowd out that Methanobrevibacter smithii. Not that it's a totally normal thing to have in your gut, but if it overgrows, then that can cause problems. In terms of hydrogen sulfide, that's new enough that I don't think we have the data to really know how helpful the low FODMAP is, because the way we have been diagnosing that is based on symptoms and flatline breath tests, because gases can be converted to each other. So hydrogen can be converted to methane or to hydrogen sulfide, making it look low throughout the whole test.
The plot thickens.
Yeah, there's this sort of classic look to a test that may be hydrogen sulfide positive, but we don't really know, yes, that's what this is. And so based on that, I can see what's effective for it. The other thing I would think about with food too is just spacing, not snacking throughout the day. I think in addition to what foods you eat, timing can be really important.
Yeah, on this, thanks for taking us through the different sort of testing, because it's always a challenge, and it's great to hear your perspective just from a clinical angle, because sometimes we think these tests are black and white, but obviously there's a lot of gray in there. If someone was going to incorporate research and study SIBO, what's the best way for people to choose certain subtypes? Do you have a go-to in terms of, are there clinical symptoms that can help you differentiate the subtypes, or do you really need to rely on lab testing, so to speak?
So to a degree, clinical symptoms can help, but I would say it's definitely not a slam dunk. You don't necessarily know based on clinical symptoms. So in general, we think of hydrogen causing diarrhea and methane causing constipation. I have seen that be the opposite. When you have a mixture of hydrogen and methane, it's hard to know exactly what's going to happen there. Sometimes you have alternating constipation and diarrhea. And hydrogen sulfide can cause constipation or diarrhea depending on how much of the hydrogen sulfide is present. Other things you might think about with hydrogen sulfide are, is there sulfur smelling gas, things like that.
No, I think this is great, but I kind of wanted to jump on to what you were saying, because there was something in there that I found really interesting when you said that some people are a mixture. Is it true that I mean, is anyone purely hydrogen or purely, methane, or is there a mix in some of the SIBO presentations? Are people on a continuum, so to speak?
Often there's a mix, but sometimes it does seem pretty clearly that people are hydrogen or methane positive. So in order for methane to show up on a breath test, I think it has to be at least 10 to the fifth. You have to have a fair amount of methane to show up on a breath test. So even if it's not positive on the breath test, it doesn't mean that it's not there. Hydrogen, because it can be converted into methane and hydrogen sulfide, I think sometimes it's present even when we don't see it on the test. It's not uncommon for me to treat somebody with what looks like methane SIBO, meaning their hydrogen levels are normal, but their methane is high. And then as they are treated, their methane levels drop and their hydrogen levels rise because that conversion isn't happening anymore.
And it sort of makes sense because you are selecting for various bacteria as you change the environment there, doesn't it?
Mm-hmm.
Yeah, exactly.
Depending on your treatment. Mm-hmm.
And Raja, I was wondering if those type of GI symptoms relate to certain doshas.
Oh, you mean in the Ayurvedic doshas? This is very interesting. Probably we need more research to tie those together. Actually, on that note, since you're also a practicing acupuncturist, do you bring acupuncture into the conversation when you're talking about SIBO? Is there a role? Maybe a naive question, but I'm curious to hear your thoughts on that, Lela.
Absolutely. Yeah, I do think that there's a role. I haven't found that acupuncture on its own really can cure SIBO, but it really, really helps with symptom management. And I think the patients that I've had that have, as you probably know, SIBO tends to be recurrent in many, many people. It comes back a lot. And the patients I've had that haven't had recurrent SIBO are those who get acupuncture regularly. And I don't know if that is just so happens to be, or if, there's a bigger relationship there. But for symptom management and hopefully for prevention, I think it can be helpful.
Yeah, this is very interesting. I mean, to jump back to your question, Hadar, I mean, if I looked at it from an Ayurvedic perspective, if someone has a bit more constipation, that means that the doshas are imbalanced towards kapha. Whereas if there's a bit more diarrhea and this IBS sort of symptoms, then you have more like the pitta and vata. So there are different approaches even in Ayurveda they didn't call it SIBO, but there are different approaches to these symptomologies. But, when it comes specifically to SIBO, it's very interesting to hear your point, Lela, because maybe there's something to the fact that, we have to channel some other ways to get at digestive wellness beyond just, what we're putting in our mouth.
Yep, definitely.
So now so that leads me to another question here. When we look at the studies that have looked at SIBO for treatment in rosacea, for example, a lot of those studies have looked at using rifaximin. It's an antibiotic. But, now I see more and more folks are going towards non-antibiotic treatment approaches. So I know you talked a little bit about food, but can you talk about what are the general approaches to treatment? When you're thinking about non-antibiotic approaches, are there botanicals that you incorporate, or are there specific, instead of just a low FODMAP diet, are there specific foods that you tend to incorporate? I'm curious to hear your thoughts on that.
Yep, definitely. So I think of three main treatment options, and I talk to my patients about all three of them. So antibiotics would be the one category, herbal medicine, and then elemental diet. So in terms of herbs, we are often using antimicrobial herbs to try and kill the bacteria in the small intestine. We are also using herbs to help deal with symptoms, depending on what those are. With constipation, we might be using herbs that help with constipation or with diarrhea. And often we're using herbs that are prokinetics to help move things forward in the intestines so they don't back up and cause SIBO. Then the other treatment option would be an elemental diet, which is basically a liquid diet that is all of the nutrients that you need, but broken down into their most basic form. And so it basically starves the bacteria of nutrition.
And then in terms of when you're talking about treatment again with botanicals, if you're giving an herb that has antimicrobial effect, this was a question that was posed to me, and I thought maybe, Lela, you can offer some insight onto this. I have a friend who's a microbiologist, and he was asking me that if you're giving herbs that are antimicrobial or have antibiotic effects, how is that different than just giving an antibiotic? I'm curious to hear what your thoughts are on that, because I thought it was an interesting point, but what would you say to someone that says, how is giving an antibiotic herb different from giving an antibiotic?
In theory, it's not really that different. I mean, antimicrobial herbs are killing bacteria. They're not selective. So you're just killing whatever bacteria is there. And, maybe they have different side effects or potentially fewer side effects, but it's the same concept. You're basically giving something to kill bacteria. You're not specifying where it's killing the bacteria or what bacteria it's killing. We also have some, concern that there may be resistance that can develop to herbs as well.
Oh,
as it
interesting.
does with antibiotics. And so to prevent that, I'm often rotating herbs for people every 4 to 6 weeks. Maybe they're switching herbs, alternating things to sort of keep the bacteria guessing and to prevent resistance. I don't see it very often, but I have seen times where a patient responded really well to an herb and then didn't respond again to it.
You know what? It's interesting because one of the things I wanted to say to answer your question, Raja, is I think that herbs have the potential to avoid resistance because they are living organisms that can evolve. And if you provide the right growth and right challenges, they may evolve to avoid this kind of mechanisms in bacteria that cause resistance. So I think that's where they can actually work faster than science, maybe, because they are really clever life forms.
Yeah, it's an interesting area. Now, apart from herbs, I've been hearing a lot about probiotics or prebiotics or trying to seed that area of the gut with certain bacteria to try to crowd out the bad actors, so to speak. Lela, where are we at the state of clinical use, and what are your thoughts on probiotics?
So there was a systematic review done in 2017 looking at probiotics for preventing and treating SIBO. Mm-hmm. And essentially that found that probiotics were useful in treating SIBO and not necessarily in preventing it. So I think we have a fair amount of good data to support the use of probiotics in SIBO. That said, if you talk to anybody who treats a lot of SIBO, there are a lot of people who have a lot of concern about using probiotic for a couple of reasons. I would say personally, almost half of the patients that I have that I give probiotics with who have SIBO will feel worse on them. And that's usually a sign to me that they have SIBO. Like if I'm giving somebody a probiotic for their digestive symptoms and they feel worse, then I'm starting to think that they have SIBO. And that may be because we're inoculating the small intestine with more bacteria. You're taking a probiotic orally, and then it's, going through the small intestine. And what's to stop it from inoculating the small intestine. But also we know that probiotics work in different ways and potentially actually providing bacteria that live in the intestinal system may not be the whole story. It may be cell signaling that's changing things. We know that probiotic species that are dead and given in capsule form still have effect. So I also have some thought about how histamine is affected by probiotics and whether that is making people's symptoms worse. A lot of people who have SIBO don't tolerate histamines well while they have SIBO, and some probiotics can increase histamine in the system.
Yeah, I think this is very interesting when you talk about probiotics because there are so many different strains and so many different variations. Do you have any thoughts about any particular strain, or what about some people are talking about spores and using spore-based approaches instead and then letting that go into a vegetative state? Are there particular probiotics that you think may be worse off to use or better off to use?
So often we use, or I have used, Saccharomyces boulardii as a yeast-based probiotic.
I see.
Because I feel like maybe there's less risk of bacterial overgrowth with a yeast-based probiotic. People tend to tolerate it pretty well. Mm-hmm. I think spore-based probiotics are really interesting. I think there's more and more research coming out around spore-based probiotics that's really interesting. So I think that those could be potentially very useful in the treatment of SIBO. I have tried using spore-based probiotics as well and have had similar issues with people not being able to tolerate them, but I would say less so than traditional probiotics. And I think really we're starting to get down to species level information here. Like the data that we're starting to look at is what specific strain is going to be useful for this person. And so then that starts to get really complicated.
Yeah, that's going to be a whole new area of research. And what are your thoughts on proton pump inhibitors or anything that reduces the acidity of the stomach? Does that increase your risk for SIBO? What are your thoughts there?
So anything that reduces the acidity of the stomach theoretically would prevent bacteria from being killed entirely by the stomach acid. Not that it's 100% killed all the time anyway, but more of it would get through. And then that would potentially increase risk for SIBO. That said, more recent, smaller, shorter term study looking at that didn't necessarily see that that was a problem, but it makes a lot of sense theoretically that that could be going on. So in general, we want to, make sure that people have a healthy amount of stomach acid, especially if we're trying to prevent SIBO recurrence.
Wow, Lela, that was an excellent tour of SIBO and its effect on the gut and how to test and how to treat, just in general, broad strokes. So thank you so much. This was very insightful. I certainly learned a lot, and I can't wait to talk more about this with my patients and perhaps refer them to some of the resources you mentioned. I certainly think that we should post one of those apps you mentioned in the chat box with our podcast.
Definitely.
Yeah, and on that note, Lela, do you have any other resources that people can look at to learn more about SIBO?
Yeah, so Dr. Allison Seebecker has a website, siboinfo.com, that is just a wealth of information for both clinicians and patients. She also posts most of the recent studies about SIBO on that website, so you could keep track of that. She has a lot of handouts and resources. So I would say that is like a number one go-to resource to learn more about SIBO. And then the Monash University app are probably the two biggest things I use in my practice a lot.
Well, thank you. I think we'll post those resources, and certainly you have turned to become a great resource as well. So thank you so much for your time and for joining us.
Thank you so much for having me. It was a pleasure.
Yes, Dr. Lela Altman at Bastyr University, for those that want to look her up. And we thank you, and this was an awesome session.
Thank you.
Thank you for tuning in to the Learnskin podcast with Dr. Raja and Dr. Hadar. Learnskin provides continuing education activities with an integrative and innovative approach that you won't find anywhere else. Become a premium member today to access our entire catalog of content, enhance your practice, and improve patient outcomes. Learn more at learnskin.com/membership.